So today's topic is macrominerals, chapter 9, page number 174. Those who have the textbook, chapter 9, page number 174. Am I audible to all? If anyone is joining late, please help them out with the page numbers. Macrominerals, chapter 9, page 174. We'll start today's session. Macrominerals in general, it means that these are minerals, okay? You require them in large amount, okay? Not like the trace minerals and microminerals like iron, okay, selenium. These kind of iron and selenium and much more cobalt, okay, copper. These things you require in very small trace amount on a daily basis. But macrominerals you require it in a much larger quantity. That's the reason why we call them as macrominerals. They include calcium, phosphorus, magnesium, sodium, potassium, chloride, and sulfur. Okay. The trace minerals or microminerals, you need them in very small amount. Okay. For example, trace minerals. These are the examples of trace minerals, microminerals like iron, manganese, copper, iodine, zinc, cobalt, fluoride, and selenium. These are the trace minerals. Okay. So that's the major difference between macrominerals and microminerals. Macrominerals on a daily basis. Okay, if you go by the RD basis, macrominerals you require it in much larger quantity, more than 500 mg and all. Okay, mostly macrominerals you require them more than 500 mg quantity. So that is macrominerals. Microminerals is less than 50 mg per day. Anything that is less than 50 mg, 20 mg, 10 mg, 4 mg per day. These all comes under trace minerals or microminerals. So the first macromineral we'll discuss is calcium. So calcium is one of the major element in your body. An adult man who is around 60 kg has around 1 kg of calcium, 1 kilogram of calcium in their skeletal as well as the soft tissues. Even soft tissues of your body has calcium. It's not just in your bones and teeth. Apart from that, calcium is also present. Calcium ions keep circulating in your blood. They are also present in your soft tissues as well. Okay. Wherever contraction, muscle contraction is required, calcium is required there. Okay. 99% of calcium is found in hard tissues. For example, your skeletal system, your bones, your teeth. Okay. Rest of it is in your blood and soft tissues. Calcium that is present in the blood plasma should be in this normal range, 9 to 11 mg per deciliter. This is the normal range of calcium that should be circulating in your blood. When you do the blood test, your normal calcium range should be around 9 to 11 mg per deciliter. So coming to calcium, main function in your body is bone formation. Okay. Specifically, not just calcium, but phosphate, magnesium also. They also help in bone mineralization, bone formation. But 39.9% of the bone weight or bone mineral composition, it's made up of calcium. Okay. And if you take any adult skeleton, not just a man skeleton, but also a female adult skeleton, if we just take the amount of calcium that is present in our entire skeletal system, the bone structure, okay, for an adult woman or a man, it's approximately around 1 kg. Okay, if you are an adult man or woman, you have approximately 1 kg of calcium, just calcium mineral deposited within your body. And this bone mineralization, it can take place in different ways. The most common one I have shown here on screen. I'll explain this. So you have to see these phases, okay? Phase 1, phase 2, phase 3, and phase 4. Phase 1 is the osteoclast phase. Okay, osteoclast and osteoblast these are the two important components that lead to bone formation. Bone formation does not only happen in your childhood. Even when you are an adult, bone formation is a continuous process. Okay, because calcium demineralization does take place in your body whenever your blood calcium level goes down, okay, bones are the first are the first tissues that are ready to keep up its own calcium ions, just so that the blood calcium homeostasis can be maintained. Okay, so whenever the blood calcium level is going down, automatically calcium from your bone is taken up. Okay, bone demineralization is taking place. It happens throughout your lifespan. Okay, throughout your lifespan, but will you have a healthy body or not? It depends upon your calcium intake. Even if the bone demineralization is taking place, calcium is being given up. Okay, bones are giving up calcium for maintaining the blood calcium circulation. Okay, but your diet will decide how much calcium will again go and re-mineralize your bone. Okay, so this is an active process. It happens even when you are resting. Okay, even right now, even if you're in an adult body, early, mid-adult, late adult, senior citizen. In senior citizens, this is a very slow process. But if you are in an age group below 30, this is much more fast process. With age, the bone formation slows down. Okay, the rate of bone formation definitely slows down with age. Okay, so here certain medical terminologies I will explain. Okay, so those who are not from the medical background, please try to pay attention here. If you have any queries, I can explain this all over again as well. Okay, so first you can pay attention here. So osteoclast, osteoblast, osteocytes. These are this is what we call as different kind of bone cells. Osteoclast, osteoblast, and osteocytes. Okay, osteocytes means osteo means related to bone. Cyte means cell, bone cells. Osteocyte means bone cell. Okay. What is osteoblast? Those who are from the medical background, if any you can find any correlation. What would this term mean? Osteoblast. You can put it in the chat box. Osteoblasts are immature bone cells which require calcium deposition so that they can form into bone cells. Okay. Osteoblast, they are bone cells. They are definitely bone cells, but they are in an immature form. Okay. So they're immature bone cells with calcium mineralization, phosphate mineralization, and magnesium mineralization. When these minerals come and deposit themselves around the matrix of this osteoblast, that's when you get a osteoid or a healthy bone. Slowly it develops into a healthy bone. Okay. What is osteoclast? Osteoblast is something that leads to bone formation. Osteoclast does the opposite. Osteoclast does the opposite. If you can see, this is an entire circle. Okay, this is a cycle. It's completely cycle. The bone has to go through all these phases. So this is the resting phase. Okay, let's say fourth phase. We can start from the fourth phase as well. It's completely okay. Okay, this is the resting phase. The bone tissue is intact. Your bone is intact. What do you think the osteoclast is doing here? Just by the image, what do you think the osteoclast, these blue cells are osteoclast. Okay, osteoclast resorption. What do you think is happening here from the resting phase to the first phase? From the resting phase to the osteoclast resorption. What do you mean by resorption of bone, or what is happening here? Yeah, deteriorating, breakdown. Yes, true. Demineralization is taking place, right? Bone tissues are getting broken down. This is the function of osteoclast. Osteoclast is required so that your bone tissue is broken down so that it can release. Only when the bone tissue breaks down, when the matrix of the bone tissue breaks down, calcium, magnesium, and phosphate ions can be released into the bloodstream. Okay, so osteoclast is required. Okay, breakdown is taking place. But then In the next phase, osteoblast activity starts. Okay, this is the form. This is where the osteoblast, immature bone cells, come into play. Okay, they start remodeling the bone back. You can see here the difference. How much depletion has taken place here? How much breakdown of the bone tissue has taken place in the first phase? And from there, if you compare to the second phase, how the with the osteoblast, these small cells are osteoblast. Okay, osteoblasts are creating the bone matrix back again. Okay, they are creating the osteoid. Osteoid means matrix. Okay, in the osteoid is the matrix. In this matrix, there are pockets where calcium minerals and phosphorus minerals and the magnesium minerals can come and deposit. Okay, that's when you get a healthy bone. So from osteoclast is breaking down the bone. Osteoblast is rebuilding the bone. Osteoblast is making the matrix. Okay, because of this matrix, calcium ions, calcium and phosphorus and magnesium, everything can come back and deposit itself. You can see here from second phase to third phase. Okay, here the mineralization has not begun. It's just in the matrix formation. Okay, osteoblast is creating the matrix with pockets, with spaces where in future minerals can come and deposit itself. Okay, so osteoblast is creating a matrix. Okay, osteoid has been formed. This matrix is called osteoid. In the third phase, you can see mineralization. So this osteoid slowly, one by one, layer by layer, the osteoid will get filled up with calcium minerals, magnesium, and phosphorus minerals. Okay, so you can see here, it will not happen suddenly, one by one. Okay, slowly the mineralization takes place. New bone is being formed, and slowly when the entire osteoid matrix is mineralized, you get a healthy bone, which is again in the resting phase. Again the cycle will continue. Osteoclast will come, break down the bone. Osteoblast will make the osteoid matrix. This matrix will get mineralized, and after mineralization you get a healthy bone. So this cycle goes on and on. This is the bone formation. It takes place throughout your life. When you get older, when the aging process kicks in, when you get older, this process is still there, but in a very slow version. Okay, this process is slowed down with your age. Is it clear to all what is bone formation now? In detail, they have explained in the textbook, which is much more medical terminology inclining. Okay, so I have just broken down the concept into this particular slide. This video will be uploaded in YouTube, so you can re-watch this again and again to understand it. Is it clear to all about bond formation? And it takes about 160 to 200 days. Okay, just between the first two phases, breaking down the bone and getting the matrix formation formed again. It takes almost 160 to 200 days. If you have any queries, you can ask. This is what you have to understand. Okay, when from the entire topic of bone formation, this is what you have to understand. Osteoid is the matrix. It's an empty matrix. In osteoid, you have a matrix that has enough space. It has space for the blood vessels too. This matrix has the space for the blood vessels too. Even through your bones, the arteries, veins, the blood vessels do flow. Okay, so the matrix has spaces for the blood vessels too. It has pockets for the minerals to come and deposit for mineralization. Okay, so that is osteoid. So osteoid has to be present. The matrix, an empty matrix, has to be present for it to become a bone in the future. Osteoid becomes into a bone after mineralization. After successful blood supply, blood vessel formation, osteoid becomes into a bone. Yeah, osteoclast is also a bone cell. Okay, if you consider a bone tissue, what a tissue? A group of cells form a tissue. Okay, take a bone tissue. Bone tissue will definitely have osteoclast, osteoblast, osteocytes. Okay. See, you can see here. Can you see this blue? The topmost part of each of this cross section. Can you see a blue line going everywhere in all these images? In the resting phase, The blue cells that you see on top, this is the healthy osteocyte. Okay. This specific image is, it's not exactly like this, just to give you a differentiation that these are three different cells. Okay, these are three different bone cells. Your bone is made up of three different cells. Osteocyte means bone cell, healthy, mature bone cell. That is osteocyte. Osteoclast is the one that is supposed to break down the bone. Osteoblast is immature bone cells. They have to form the osteoid. Is it clear to all? Bone cells. The collective term for osteoclast, osteoblast, and osteocyte is bone cells. Osteocyte is bone cell. Osteocyte. Osteo means bone. Cyte means cell. It's a mature bone cell. Osteoblast, if osteoblast is immature bone cell, osteocyte is mature bone cell. Is it clear now? So this is the entire process of bone formation, bone resorption, bone mineralization, bone formation. Okay, it's a cycle which goes on and on. In young children, at teenagers and young adults, the process is quite fast. Okay, it happens in a very much accelerated form. As you age, the process slows down, and along with that, when specifically in women, when you hit menopause, again the process is slowed down a lot. Okay. Even in women, after you cross the age of 30, this process is usually slowed down. The next main function of calcium is tooth formation. Okay. Yeah, in old age, it will take more than 200 days. So next function of calcium is bone formation. So when a woman is pregnant with a child, the fetus, about 20 weeks old fetus, okay, 20 weeks old fetus means around 3 months, as soon as the first trimester is over. Okay, as soon as the first trimester of the pregnancy is over. Am I audible to all? Yeah. As soon as the first trimester of the pregnancy is over, the first 3 months of pregnancy is over, when a woman is pregnant, the child she is carrying will start the tooth formation. Okay, the fetus, when it is about 20 weeks old, or automatically the calcification of the milk teeth, what we call as the deciduous teeth, milk teeth. Okay, this calcification has begun. In the fetus phase itself, the calcification has begun. Okay, and once the child has been born, okay, the child is around 6 months old and all, slowly the milk teeth starts erupting. This is when the child will start biting, okay, chewing. The child will have a sleepless night as well when in the 6 months when the new teeth is erupting. Some children, some kids, they do face pain, irritation. They may have some sleepless nights as well. You have to give them some chewable toys, chewable, non-hazardous, non-toxic toys. You can give them. You can don't give them finger food because they may choke on it. But chewable toys can be given here in this 6 months. By 6 months, slowly the deciduous teeth, the milk teeth will start to erupt. Okay, and as soon as the child, even before the milk teeth has begun erupting, before that itself, the calcification of the permanent teeth has begun. Okay, even before the milk teeth, that is before 6 months of age, even before the milk teeth has begin its eruption, calcification for the permanent teeth has already begun. Okay, around 6 months, 3 months of age, up to the age of 3-year-old. Okay, 3 months to 3-year-old, that age span. Even though the child has milk teeth, the calcification of the permanent teeth has already begun. Okay, and by the time they are complete, they are 8 or 10-year-old, all the permanent teeth should be erupted. Okay, wisdom tooth will still take time. It is very subjective. Some people get wisdom teeth as young as teenagers. Some may get it after 30s. Okay, so wisdom teeth eruption may take a lot of time. It is much different for majority of the people. Okay, but this is how the tooth formation takes place, calcification. So the importance of calcium. Now you can understand the importance of calcium in a pregnant woman's diet. It is about 1200 mg. Okay, for a pregnant woman as well as for a lactating woman. Okay, the calcium RDA is about 1200 mg per day. The reason being, it has to support the fetus calcification of teeth, deciduous teeth of the fetus, and during lactation, it has to support the calcification of permanent teeth as well. Okay, breastfeeding will go on from birth to 2 years of age, 2.5 years of age. Okay, so this breastfeeding, this lactation should be supported by a healthy amount of calcium in the mother's diet. Okay, so this is one of the reasons why 1200 mg of calcium is recommended for pregnant as well as for lactating women. Next is growth. Calcium is obviously required for growth because it helps in bone development, bone formation, the way how the child grows in height. Okay, it is completely based on the bone formation. And also the contraction, the muscles that contract, the heart muscle that contract, they also require calcium ions. So for growth, calcium is important. Blood clotting, there are around 14 factors. I'm not sure, is it 12 or 14? Those who are from the medical background, you can correct me in the chat box. Total, how many blood clotting factors are there? Christmas factor, calcium, like that. I guess around 12 or 14 blood clotting factors are there in human body. Is it 13 or 14? So blood clotting factors, these are certain elements in your body which will lead to the blood coagulation. See, whenever you get cut, or whenever you start bleeding from a point of your skin or anywhere, okay, whenever you get a cut, laceration, bruise, or something like that, blood comes out, and within few seconds the blood has to stop. Okay, because blood clot has to form. Okay, so for the formation of this blood clot or blood coagulation, there are certain factors in your blood, okay, that plays. Okay, and calcium is one of that factor. The presence of calcium is important for blood clotting. Blood coagulation requires calcium as one factor. It's a series, okay? These factors act in series. First, the first blood clotting factor has to come to play. Then only the second can start. Then the third can start. And the fourth can start. So like that. So calcium is one of these factors. So for blood clotting, blood coagulation, calcium is required. Okay. Those who are extremely low in calcium, they are prone to delayed blood clotting or delayed blood coagulation. Okay. Thromboplastin, thrombin, these all are different kinds of blood clotting factors. Christmas factor, calcium, prothrombin, fibrinogen. Okay, these are different factors, something very related to these terminologies that you do not have to study. You do not have to worry about blood clotting factors, all the 13 names. It's not required. It's only those who are from the medical background. You will study this in your anatomy, in your physiology classes usually. Okay, so in that sense, 13 blood clotting factors are there, out of which calcium is one of the blood clotting factor. The presence of calcium ions in blood will help in blood clotting, in blood coagulation. That is one of the functions. Next is contraction of muscle. So calcium ions, along with certain proteins inside the cells, and calcium ions, with the presence of proteins in the muscles or any cells, and calcium ions, both, they form this contraction of muscle, whichever muscle, not just the heart muscle, in other parts of the body as well. To help in the contraction of muscle, calcium is required. Okay, so calcium-based electrolytes are also given as emergency medication whenever a person is suffering from blood pressure, low blood pressure, okay, heart attacks, myocardial infarction. Okay, calcium channel blockers are given. calcium channel blockers are given to relax the heart. Okay, to relax the to help with people who suffer from blood pressure. Calcium channel blockers are given. Okay, those who suffer from like low blood pressure, hypertension. Okay, for them calcium related medications are given. The cardiologist will decide what kind of medication and all, but the importance of calcium we can understand here. It helps in the contraction of muscle. Intercellular messenger. Certain hormones, for their action to take place, they require calcium as a catalyst. Okay, calcium as a catalyst is required for hormones to do their function. For example, the role of epinephrine. Epinephrine is secreted by your adrenal glands. Epinephrine. Epinephrine is the flight or fight hormone. Okay. So for this epinephrine's function in the creation of new glycogen, okay, from the liver, taking out the glycogen from the liver and breaking it down. For epinephrine to do that, presence of calcium is required. So that is one function of calcium, to be a catalyst, okay, to be an intermediary in the hormonal actions within your body. Release of hormone. Certain hormones like insulin, parathyroid hormone, calcitonin, okay, from the endocrine glands, calcium ion is required. So in the absence of calcium ion, there will be under secretion of these hormones. Contact inhibition. So cell-to-cell communication also requires calcium. Cell-to-cell communication, if for example, a bacteria or a virus, okay, or any foreign object has caused an infection in the body, okay, through cell-to-cell communication, the WBCs or other the defense cells will come to know that this is the part of the body where an infection is taking place. For this to come to that particular infected area and attack the foreign object, okay, calcium, the presence of calcium ions is important because they help in transmitting the message from one cell to another cell. Okay, so that is contact inhibition. Action on heart, as mentioned, calcium directly acts on the myocardium. Myocardium means your heart muscle. Myocardium means your heart muscle. Okay, the calcium ions can directly act on the heart muscle and it can prolong the systole. Systole means what? When the heart is in a contracted state, you know that your heart contracts and relaxes. Okay, so that's because of that you get a cardiac output. When the heart is contracting, majority of the blood inside the heart is getting pumped out. When the heart is relaxing, it is getting filled up with blood. Okay, so systole means what? The contracted state of heart. Diastole means the relaxed state of heart. Okay, so to keep the heart in a systolic form a little bit longer means your cardiac output will be good. The amount of blood that the heart is able to pump out is more, because the more the heart stays in the contracted form means it is able to, the stronger the contraction, it means the more blood is being pumped out of the heart into the blood vessels, into the tissues. Okay, so that's the action of calcium on heart. Membrane integrity and permeability. Again, the cell membrane, the cell wall, okay, the amount of water and other electrolytes that should enter the cell, or the amount of water and other electrolytes that should leave the cell. Okay, this is also influenced by calcium, the presence of calcium. Next is activation of certain enzymes like ATPase, succinate dehydrogenase. Okay, these are certain enzymes. For their activation, calcium ion is required. Another enzyme is lipase. Lipase is secreted by pancreas. From the word itself, you can understand lipase means this is the enzyme. This is supposed to break down the fat. Whatever oil, fat you eat, okay, whatever lipids that enter your digestive system, to break it down, lipase is required. Lipase is secreted by your pancreas. Okay, for the secretion of this lipase or activation of this lipase, calcium ion is required. Succinate dehydrogenase is an enzyme. It is supposed to break down the water molecules. From the name itself, we can understand it takes away the hydrogen molecules. So the functions of bones, functions of calcium, is it clear to all so far? So, some facts about calcium has also been mentioned in your textbook. For PMS, women suffering from PMS, women who have a very low calcium diet, they have more pain, more water retention, and they have a less focus. Okay, when they are going to approach their periods, that is PMSing. Okay, women who have low calcium diet, they have low calcium mineral in their body, they suffer from a greater deal. They suffer a greater deal from PMS. They have a more painful periods. Okay, they have more swelling, water retention. Like before periods, if you are a woman, you know, before you get your periods, you have this swelling all over your body. Okay, it feels like you have gained weight, but it's actually water retention. Okay, as soon as you get the period, within the first 2 days, you will see yourself much lighter, and you feel like you must have lost few kilos or something. That is just water retention that happens before periods. Okay, so women who have low calcium diet suffer from this excessive water retention. They look much more bloated, much more swollen before periods. Painful menstruation, the pain level is much higher, and the lack of concentration is seen in women who have low calcium diet. Low calcium intake can lead to high blood pressure as well. And colon cancer, calcium supplementation has been found to reduce the chances of risk of colon cancer. This is the absorption of calcium ion. If you read the textbook, you will find it a bit confusing because it is much more biochemistry, medical terminology oriented. Okay. Here, TRPV6, you can see this purple cylinder kind of situation here. This is a TRPV6. It's a calcium channel. This is an enterocyte. What do you mean by enterocyte? What is an enterocyte? Enterocyte. Cells of the intestine. Okay, cells of the intestine. It will not be your GI tract cell. GI tract means gastrointestinal tract means it starts from your esophagus. You will not find enterocyte in the esophagus. You will not find enterocyte in the stomach, duodenum. In duodenum, you will find it's a part of your small intestine. Only intestinal cells are called enterocyte. Okay. So this is just consider this structure as one cell of your intestine. Intestine is where the absorption of your food takes place. Okay. So this channel, okay, this TRPV6 stands for transient receptor potential vanilloid channel. Okay. Just you can Google it if you want to, or just know it as a TRPV6. Okay, it's a specific channel through which only calcium ions can enter inside the small intestine. Okay, so this is the lumen. Lumen is where the food, the partially digested food enters. This is the villi. You see the zigzag here. This is the finger-like projection. This is the intestinal villi, which is supposed to suck in all the vitamins, nutrients, macros, micros. Okay, so the calcium has a specific channel. Through this specific calcium channel, absorption of calcium takes place. Okay, and as soon as the calcium ion enters the small intestine, you can see this orange C-shaped structure. This is called the cal binding. It's a protein. It's a protein. Okay, so cal binding is a protein. Only with the help of cal binding calcium ion can travel across the cell. Okay, without calbinding, calcium ions cannot travel from point A to point B. Calbindin is required so that the calcium ion can travel across the intestinal cell, go on the other side and be released into the bloodstream, into the capillaries. Okay, so when the calcium is going to be released into the blood capillaries, magnesium gets inside the enterocyte. There is an exchange taking place. You can see here in this part, calcium is leaving the enterocyte. At the same time, magnesium, Mg is magnesium, is entering the enterocyte. And this exchange has to take place. If calcium has to enter into the blood circulation, you can see here this red part means the blood capillaries, your blood circulation. If calcium has to enter inside the blood circulation, an exchange of magnesium has to take place. Okay, so this is the series in which calcium absorption takes place. First of all, a specific calcium channel is required, which is called the TRPV6, transient receptor potential vanilloid channel. It's a channel specifically for calcium through which calcium enters the enterocyte, and with the help of this calbindin protein, calbindin is a protein. Okay, with the help of this protein, calcium can travel from point A to point B and be released into the bloodstream when there is an exchange of magnesium. This is how calcium absorption takes place in your intestine. Is it clear to all? Any doubts in calcium absorption? So in an acidic environment, okay, when the intestinal environment is more acidic, it is much more efficient for calcium absorption. Okay, that you have to remember. The environment has to be acidic, slightly acidic. The majority of the calcium absorption takes place in the ileum, duodenum, jejunum, ileum. Duodenum, jejunum, ileum. These are the three parts. These are the three parts of your small intestine. Okay. In duodenum and jejunum, it is more acidic, so calcium absorption takes place. But in ileum, majority of the calcium absorption takes place because majority of the calbindin is present there. Okay. Yeah. Magnesium enters the enterocyte and calcium leaves the enterocyte. You can see the arrow marks. Blood will carry magnesium, deposit it into the enterocyte for defecation. Magnesium will be sent out of your body. So blood will get the magnesium, deposited into the enterocyte. Calcium will be taken into the bloodstream. And whatever dietary calcium you have, okay, 30 to 40% of it is absorbed in adults. And if you have growing children, if you're dealing with a children age group, if you're dealing with a pregnant woman, lactating woman, the calcium absorption is much higher than a normal adult. When you are pregnant or when you're lactating, the rate of calcium that is going to be absorbed by your intestine is much higher, 50 to 60% of dietary calcium. For example, you had 1000 mg of calcium. Okay, the entire 1000 mg will not be absorbed by the body. 60% of it will be absorbed in pregnant, lactating, and growing children. Hardly 40 or 50% can be absorbed in a healthy adult. Okay. And with estrogen, this is one of the reasons why menopause has a great impact on calcium absorption. Because in women, the presence of estrogen enhances your calcium absorption. Okay. And that's the reason why after menopause or whenever you're attaining menopause, going to attain menopause, the estrogen levels automatically falls down. It begins to fall down in women. So as soon as the estrogen levels fall down, the rate of calcium absorption also decreases in women. So factors favoring absorption. What are the factors? What are the other external factors that push more absorption of calcium, which supports the absorption of calcium? First is vitamin D. The presence of vitamin D, that also active form of vitamin D. That is 125 dehydroxycholecalciferol, which is hormonal. Okay, vitamin D is the only vitamin which we consider it has the functioning of a hormone. It acts like a hormone within your body, specifically in its active form. Active form of vitamin D is 125 dihydroxycholecalciferol. Why 125? It's a carbon chain. The first and the 25th carbon chain has hydrogen ions on it. That's the reason why 125 dihydroxycholecalciferol. So the presence of this active form of vitamin D enhances the absorption of calcium. Okay, specifically the calbindin. The calbindin, which is present in the intestine, you can see here this orange part, the C-shaped calbindin. Okay, it promotes the calbindin within your intestine, because of which calcium absorption is enhanced. And just by the presence of vitamin D, a good amount of vitamin D in your diet, 10 to 30% increase in calcium absorption is seen. Okay, that is the reason why, if you have noticed, if you ever have any vitamin D supplements, okay, if you're deficient in vitamin D, usually you have to take the vitamin D with milk. Okay, a cattle milk or a dairy milk. You with that you have to take the vitamin D supplement weekly once. If at all you have been on vitamin D supplements, this is what the physicians usually prescribe. You have to take it with milk. Okay, because just like how vitamin D enhances calcium absorption, the presence of calcium enhances vitamin D absorption. Okay, so both are complementary to each other in terms of absorption. Then acidity of digestive mass. As I mentioned, when the pH is lower, low pH means acidic. When the environment is acidic, if your intestinal environment is acidic, it promotes more absorption of calcium. Okay, specifically in duodenum and jejunum. The duodenum and jejunum, you will have higher pH. You will have lower pH because the food has just arrived from the stomach. Stomach has hydrochloric acid. So this hydrochloric acid mixed food has just entered the duodenum and just entered the ileum. So it's naturally a bit more acidic. When it comes to the ileum part, the last part of the intestine, it is much more alkaline. Okay, it has more mucus. It is much more alkaline in nature. But if the calcium ion absorption has to take place in the duodenum and the jejunum part, the top two parts of the small intestine, that the acidity, the presence of acidity, acidic environment is very important. Next is lactose. Where do you find lactose? In which products do you find lactose? In which food you will find lactose? All the milk products, dairy products, they have lactose. Okay, so the presence of lactose, that more efficient in infants. Okay, presence of lactose in the foods of infant helps in the absorption of calcium. And lactose is much more prevalent in human breast milk as compared to cow milk or buffalo milk. Okay, just by the presence of lactose, 33 to 48% increase in calcium absorption is seen. And beyond, after, this is only for infants. Okay, this is not for adults. Lactose, the presence of lactose in the food for calcium absorption is for infants. But we do not have substantial evidence that supports that lactose in a human adult diet can also improve calcium absorption. We do not have much reasoning towards that. But for infants, definitely the presence of lactose has seen to increase the calcium absorption. But after infancy, when they grow up, even when they are child, preschoolers, toddlers, There is not much evidence on lactose and its effect on calcium absorption. Protein and phosphorus. So protein definitely increases the calcium absorption. Can you give one reason why? How could protein lead to calcium absorption? Any guesses? Yes, cal binding is one of the reasons. Proteins are basically amino acids. Proteins are made up of amino acids. Proteins are broken down and again made into amino acids used to make different kind of proteins in your body. Okay, cal binding is also one kind of protein. So the more protein you have in your diet, you have more access to cal binding within your intestine, and which promotes more calcium absorption. But if your diet has less than 500 mg of calcium per day, the presence or absence of protein will not have any major role. Only if you have higher amount of calcium intake, more than 800 mg of calcium you take on a daily basis, only then the increase of protein can aid in the calcium absorption. Okay, if your calcium intake is too low, less than 500 mg, the presence or absence of calcium will not help much. Okay. Also, the presence of phosphorus. There is an inverse relationship of dietary phosphorus intake and calcium. Okay. Which means if the phosphorus intake is high, calcium absorption falls down. If the calcium intake is high, phosphorus absorption falls down. That is the inverse relationship. Next factor is the need for calcium, which happens specifically during pregnancy, lactation, growing years of the child, that is school children and teenagers. Definitely your body has a higher requirement for calcium. If you compare these physiological phases of pregnancy, lactation, adolescence with other age groups, okay, other age groups or other phases of life, definitely the need of calcium is much higher. When the need of calcium is higher, automatically the body will be in a will tune itself in such a way that the absorption of calcium is also higher. Whenever the need is high, now automatically the absorption rate will also be high. Okay, this I mentioned earlier. During pregnancy and lactation, the absorption of calcium is about 50 to 60% in adults. Okay, but if you're talking about a non-pregnant, non-lactating woman or an adult man, the calcium absorption is hardly 40 to 50%. Okay, so when there is a need for higher, when there's a demand for calcium in your body, automatically the absorption rate increases. So is it clear about the favoring factors of calcium absorption? Next is the factors that suppress or depress the calcium absorption. So these factors will inhibit the calcium absorption. First is oxalic acid, which is present in food like spinach, high green leafy vegetables, multigrains and whole grains with the husk. Okay, majority of the whole grains has high amount of phytate and oxalate. Oxalic acid is present in green leafy vegetables, dark green leafy vegetables. Okay, so how it happens is that this combination of oxalic acid and calcium, they form a precipitate. Precipitate means, if you understand from the chemistry, precipitate is something that is insoluble. You cannot absorb it. It forms an insoluble component which cannot be absorbed by the intestine. So that is how the presence of high amount of oxalic acid will lead to an insoluble complex, which will not allow the intestine to absorb calcium from that. So that is called calcium oxalate, oxalic acid plus calcium, calcium oxalate. It cannot be absorbed. Next is phytic acid. So here phytates are, yeah, spinach also has high calcium. Spinach also has, spinach is rich in is calcium rich, but the presence of oxalic acid makes spinach not a best source of calcium. Spinach can become a best source of iron. Okay, spinach can become a best source of iron, but the presence of oxalic acid will pull back the calcium and it will push forward the iron absorption. Okay, so you cannot say spinach is the best source of calcium. Spinach is definitely a best source of iron, but not calcium, just because the presence of high amount of oxalic acid. Okay. If you take any vegetables or fruits for that matter, your soil is the rich source of calcium. All majority of fruits and vegetables have calcium in that, but it does not make it the best source of calcium. When we are talking about sources, whenever you talk about sources of any food, you have to focus or give examples of the best sources. Okay, spinach has iron, magnesium, selenium, majority of whatever minerals you find on soil. Okay, all these minerals are found in vegetables and fruits. Okay, but it does not make it the best source or the rich source of that particular mineral. Okay, phytic acid are again present in whole wheat. So if you are having whole wheat flour in your diet, and along with the same time, at the same time, if you are having some calcium rich food, it will lead to calcium phytate and all. Again, it's an insoluble component. So it will not just reduce the calcium absorption, but it can also reduce the vitamin D absorption as well. The presence of phytic acid. So oats, unrolled oats, your whole wheat flour, okay, cereals that are cereals also have high amount of phytic acid. Specifically, the outermost layer of the cereals, they have a high amount of phytic acid. If it is polished cereals will not have much phytic acid, so that will not lead to any reabsorption of calcium. Then steroteria, it means too much of fat or lipids are lost in your feces when you're defecating. Okay, when you're passing your feces, a lot of fat and oil, unabsorbed fat, oil, and lipids leave your body along with the feces. Okay, foul smelling stools, which has a huge amount of fats. So in that also calcium absorption is certainly reduced. Not just calcium absorption. If you come across any person who is suffering from steatoria, they are suffering from various amount of deficiencies, not just calcium deficiency. If a person is suffering from steatoria, it means their intestine requires some rewiring because it's not breaking down the fat. Fat breakdown is not taking place either because of the issues with lipase secretion. Okay, when fat breakdown does not take place, it will inhibit the absorption of various vitamins and minerals. Okay. Then emotional instability in form of which comes in form of stress, tension, anxiety, grief, depression, any mental health disorders. Okay, even boredom, lack of physical activity, not being active, not doing any weight bearing exercise, not keeping yourself physically active, that could also lead to decreased calcium absorption. Then increased gastrointestinal motility, which happens when during diarrhea. Okay, people who are suffering from diarrhea, or if anyone is taking lots of laxatives, that could also decrease the calcium absorption because calcium has very less amount of time to be in the GI tract to be absorbed. Increased GI motility means things inside the GI tract is moving way too fast without being absorbed. So calcium being one of them will lose its absorption chances. Lack of exercise, as I mentioned, people who do not engage in any weight-bearing exercises, walking, okay, even walking is also a weight-bearing exercise. Anything that has a use of gravity, okay, any exercises in which gravity plays an important role becomes a weight-bearing exercise. So walking is something very simple, and it's also a weight-bearing exercise. Bedridden people, okay, who are in comatose or who are paralyzed or who are bedridden, they also can lose a lot of their bone mineral, calcium mineral. And the ability to replace this is also quite low. Next is the process of aging. Calcium absorption decreases during old age. And along with that, if you are deficient in vitamin D and you have some parathyroid issues, parathyroid issues, that can also increase your risk of fractures because of calcium malabsorption. Caffeine, high intake of too much of coffee intake, too much of tea intake, okay, that can also decrease your calcium absorption. Specifically, when you're having tea, coffee, along with the same time you're having some calcium-rich food, the rate of calcium absorbed is much, much lower, okay? So you should keep a healthy spacing between having tea, coffee. Tea, coffee, you can have it, definitely, but have a healthy space of at least 1 hour, 1 or 2 hour space should be given between having tea, coffee, and then having a calcium-rich food. Or have it before and then later you can have the tea or coffee. And certain drugs like anticoagulants, cortisones, thyroxine. Thyroxine is the medication given for hypothyroidism. Thyroid patients, hypothyroid patients gets thyroxine medication. So these medications can also reduce the calcium absorption. So these are the factors that can depress your calcium absorption. Is it clear to all? Yeah, more or less, majority of these factors will applies for iron absorption as well. Next is the metabolism of calcium. So calcium will be transported from the blood to the extracellular fluids. From the blood, it will be taken into the fluid which is just outside the cell. Calcium will be deposited into the extracellular fluids. And from the extracellular fluids, as and when cells require, okay, based on the cell membrane permeability, as and when the calcium is required from the extracellular fluids, cells will take in as much calcium as required, okay? And 99% of calcium is reabsorbed in kidneys, which means even if the cells don't take up majority of the calcium, and when it is given back into the blood circulation, the blood will take that to the kidneys for filtration. And even after filtering out calcium, majority of the calcium is reabsorbed by the kidneys back into the bloodstream. Okay, the calcium that is supposed to leave the body through urine, kidneys will not allow it to leave it. 99% of calcium will be taken up by the kidneys and it will be put back into the system. That is the reabsorption of calcium in the kidneys. And majority of this reabsorbed calcium will be used by the bones for its calcification. Okay, so the first priority here goes to the cells. It goes to the extracellular fluids. from the extracellular fluids, cells will take up whatever is required. Remainder will be pushed back into the blood. This extra calcium taken from the blood will go to the kidneys for filtration. Again, it is not filtered out. It is reabsorbed by the kidneys back into the system. And whatever calcium is reabsorbed by the kidneys back into the system goes to the bones for calcification or mineralization. Okay, so this is how calcium passes through the entirety of your body. Next, the hormonal control. First is your parathyroid hormone. Parathyroid hormone is supposed to decrease the amount of calcium ions in your blood. Parathyroid hormone is supposed to decrease the amount of calcium ions which is in the circulating blood. So as soon as the phosphate ion is important here. Phosphate ion, the high amount of phosphate ion will trigger your parathyroid hormone to release the parathyroid gland to release the parathyroid hormone. As soon as the parathyroid hormone is released, calcium levels in the blood will drop. As soon as the calcium levels in the blood will drop, what will happen? The bone demineralization will start. Okay. So phosphate will trigger the parathyroid gland to secrete more parathyroid hormone. Once the parathyroid hormone is in the blood, calcium ion comes down. So blood's calcium level falls down. As soon as the blood's calcium level is falling down, automatically it will signal the bones to give more calcium out. So that's how bone demineralization takes place because of high phosphate ion. This is how phosphate and calcium has an inverse relationship. The amount of phosphate increases, the amount of calcium decreases in your body. The amount of phosphate increases, the amount of calcium decreases. High amount of phosphate ions will trigger your parathyroid gland to secrete parathyroid hormone. As soon as the parathyroid hormone is in your blood circulation, hormones will be in your blood circulation. Okay. So as soon as the parathyroid hormone is being secreted into your blood circulation, calcium ions which are already in your blood will fall down. Okay. So now you are in a state of hypocalcemia. Hypocalcemia means you have very less calcium ions in your blood. So the blood has to bring that balance. From where will the blood bring the balance? From the bones. Okay. So the bones will start to give the calcium ions into the blood to bring that balance of calcium ions back into the blood. So this is how increase of phosphate ion can decrease the calcium mineral in the bone. Okay, this is the inverse relationship of phosphate and calcium. Is it clear to all? Next is calcitonin. So calcitonin is another hormone secreted by your thyroid gland. Thyroid gland secretes, apart from T3 and T4, calcitonin is also another hormone secreted by thyroid gland. Okay. Thyroxine and triiodothyroxine, these are the two hormones secreted by thyroid. Apart from that, calcitonin is also secreted by the thyroid gland. So whenever the plasma levels of calcium is too high, okay, when the blood has high amount of calcium ions, calcitonin is secreted to bring it down, to lower the plasma calcium levels. So that's the main function of calcitonin. That's how calcium balance is found. Okay. Then vitamin D, specifically in its active form, we also consider vitamin D as hormone. The way how it acts in your body is it's very similar to how a hormone acts in the body. That's the reason why vitamin D is considered as a hormone. So it enhances the intestinal absorption of it enhances the intestinal absorption of calcium. Along with that, it enhances the kidney reabsorption of calcium as well. Remember, if you remember from the previous slide, 99% of calcium that reaches kidney is reabsorbed back into the system. That's because of presence of vitamin D. And when there is a high amount of reabsorption of calcium from the kidneys, automatically you know that it's going to calcify your bones. Okay, so in the absence of vitamin D or in the deficiency of vitamin D, what happens? Neither the good intestinal absorption of calcium takes place, neither the nor the good reabsorption of calcium from the kidneys will take place. Okay, so from both these ways, your bone calcification, your bone mineralization is affected. If vitamin D is less, if you are deficient in vitamin D, your kidneys are also not able to reabsorb majority of calcium back into the system, which should go and calcify your bones. That's not happening, and neither the intestine is able to absorb good amount of calcium. Okay. Then cytokines. Cytokines are are part of your immune system. These are immune cells. Like so changes in the calcium metabolism is also brought by cytokines, which act like a hormone. Okay, cytokines are also locally acting like a hormone. So they also promote bone resorption. Bone resorption means breakdown of bone. Okay, and only if the only if the bone is getting broken down, bone remodeling can take place. So cytokines have a very important role in normal bone remodeling, breaking down the bone and like through osteoclast, let the osteoblast come in and remodel the bone. Okay, for that entire process, cytokines are also important. So they have some role, some hormonal control over the amount of calcium used in your bone formation. So this is the hormonal control of calcium. Is it clear to all? Osteoporosis, it's a very common disease condition because of poor nutrition, specifically in women. So here the bone becomes porous because majority of the calcium is taken up to balance the calcium amount in blood. So bones are deprived of enough amount of calcium. So bones become porous. The matrix which we used to say about, okay, the osteo, the matrix, the pockets where calcium should have been deposited, there is no calcium. These are empty pockets. So it becomes porous. Okay, porous means lot of empty pockets, lots of emptiness within the bone. That is porous bone. That is osteoporosis. Okay. So there are certain risk factors of osteoporosis. Females definitely have a higher risk of osteoporosis as compared to men because of the accelerated bone loss that takes place after menopause when the estrogen levels fall down. And even if you suffer from certain hormonal conditions like PCOD, PCOS, in which the it's a spectrum, okay. But if you're suffering from a condition in which estrogen levels are very low in your system, definitely you are at a higher risk of developing early stage of osteoporosis. So gender-wise, women are more affected. According to race, Caucasians, white people, and Asian people, they are more likely to develop osteoporosis as compared to African, African race. And body size-wise, people who are small-boned, which means women and men who have short height, okay, they have higher risk of osteoporosis than people who have large bone or their height is above average. And also women who are thin throughout their life, specifically like those who lose 10% or more of their weight very frequently, they are at higher risk of hip fracture when if they fall. Family history of osteoporosis is another situation. If osteoporosis runs in your family, you are at higher risk of getting osteoporosis. And diseases, any thyroid diseases, parathyroid diseases, hyperactive parathyroid gland, kidney diseases in which calcium resorption does not take place. Okay, any intestinal diseases. Okay, these can also lead to, if calcium absorption and reabsorption is affected because of any disease conditions, it will automatically lead to osteoporosis sooner or later. And certain drugs as well, anticonvulsants, thyroid drugs, like people who suffer from hypothyroidism, they are put on levothyroxine drug. Okay, so they have higher risk of osteoporosis. Corticosteroids, steroids, those who take steroids of any case to treat any inflammation. They also have low bone density. Alcoholism, too much of caffeine intake, too much of salt intake. People who smoke a lot, okay? Those who have a very sedentary lifestyle, no physical activity. Emotionally, if you're stressed out a lot, okay, and if your diet is not rich in calcium, not having a balanced diet, even if the diet is low in vitamin D, okay, not going out, not being exposed to sunlight, okay, vitamin D synthesis does not take place. So these all are the other factors that could lead to osteoporosis. So in short, that was just a brief explanation on osteoporosis. Female athlete triad we had discussed. Again, that the chapter will be repeated. Again, it will be discussed. Female athlete triad. Do more weight bearing exercises like to prevent osteoporosis. First prevention is take a lot of calcium rich food in your diet. Have more milk and milk products, because if you leave milk and milk products, a huge chunk of calcium intake goes down. Okay. Have more sesame seeds, have more chia seeds. Okay. Nuts are good source of calcium. If you are having milk, or if you're a vegan, you cannot have dairy based milk. If you're having plant based milk, please go for fortified milk or fortified foods. Vegetarians and vegans, specifically vegans, you have to take vitamin B, vitamin B12, vitamin D, and and calcium supplements has to be taken. Okay, vegans have to take vitamin B12, vitamin D, and calcium supplements. Vegetarians, if you are on a regular basis having dairy products, milk products, you do not have to take calcium supplements. But if you, because of personal preferences, if you eat less amount of milk or milk products, you may have to be put on calcium supplements as well. Fortified means just take any packaged tetra packaged plant-based milk and just read the front or back. You will see what are additional vitamins and minerals they have added, the manufacturers have added into this. Okay, so instead of making some vegan or plant-based milk at home, it's better to go for some tetra packaging, because it comes fortified with specific nutrients that are known are deficient in vegans and plant-based diet eaters. Okay, and majority of the plant-based milk that you can purchase, they automatically come fortified with vitamin B12, D, and calcium. You can choose the brands of your choice. You can just Google it. Okay, just search for fortified plant-based milk. You will get the answer. Okay. If you are not using any fortified plant-based milk, please go for supplements based on the physician's prescription. Okay. Do your blood work, see which all areas you are deficient in, and get a prescription or a supplement for that. So prevention of osteoporosis, first dietary changes has to be done. Then weight bearing exercise has to start, specifically women. Sooner or later, around 30-year-old, whenever you're 30-year-old, around 30-year-old, start doing more weight bearing exercises, like even running, walking, playing contact sports, climbing, table tennis, dancing, gardening. Okay, these all are weightlifting, weight bearing exercises. Hypocalcemia, inadequate calcium in your blood, that is hypocalcemia. Specifically, those who have undergone some thyroid gland operation, thyroidectomy, or if your parathyroid gland is too much active, too much of parathyroid hormone being secreted in your body, That could also lead to a state of hypocalcemia. Any malabsorption because of steatoria or any stomach surgery, intestinal surgery, because of which absorption is not taking place properly, that could also lead to hypocalcemia. Kidney issues, people who suffer from kidney issues. There are certain signs and symptoms of hypocalcemia like tetany. Tetany means your muscles go into a spasm, your muscles go into a state of contraction, and it's not able to relax. Okay, that's because of hypocalcemia. And also involuntary muscle contraction. If that many of you must have witnessed, you may be not doing anything, but you see certain part of your hands or any part of your body is just going into an involuntary contraction, which is not in your control. Okay, that could be a sign of low calcium in your body. You just have the way the when you do your blood serum report, and when it is found that you are deficient in vitamin D, based on the rate of deficiency, is it mild deficiency, moderate deficiency, or severe deficiency? Based on this category, your physician will decide how long you should stay on vitamin D supplements. Okay, how long you have to be put on vitamin D supplements or even calcium supplements. It is completely based on the severity of your deficiency. If it is mild, just through diet, just making some dietary changes, you can cure it. Okay. If it is moderate to severe, you may have to take help of supplements. Is it clear? RDA for adults, about 1000 mg of calcium is required for adults. Even for children, teenagers, pregnant and lactating mothers, definitely higher. Pregnant and lactating mothers, 1200 mg of calcium is required. But for all the other age groups, more or less, except for infants and children who are below 8-year-old, except for that, if you're a teenager, then for teenagers, it should be around 1000 mg of calcium. Yeah, calcium supplements can be taken not for by prescription, not the prescription ones. There are two types of calcium supplements. One that you can get directly by placing an online order, for which you do not require prescription. Okay, and any FSSAI or ISO marked supplements, nutraceuticals, okay, that you can get. That is for maintenance. That is not to cure. Okay, the supplements, multivitamins and supplements through nutraceuticals that you buy. Okay, like Nutrilife. These are the most common brands. Okay, Herbalife, Nutrilife, okay, Bodywise. These are the different brands that we have. So when you're getting a nutraceutical supplement, it is more likely to do maintenance for you. It's not supposed to cure you. Okay, if you want to correct your, if it is a mild deficiency, definitely nutraceuticals can help you to an extent, along with good diet. Okay, nutraceuticals should not replace your, it should not replace your diet. Okay, but if you are in a moderate to severe form, you require prescription dose of supplements, nutritional supplements, which dietitians are not supposed to prescribe. The nutritional supplements that dietitian is supposed to refer is only for maintenance. Is it clear to all? So these are some of the examples of calcium-rich food. Those who have the textbook on page number 194, you can read about it. Dairy products, dairy foods are the major sources of calcium. Milk is the best source because it has vitamin D and calcium. So it's the best source. Green leafy vegetables to an extent. Ragi is also a good source of, it's not the best source, but it's a good source of calcium. Sesame seeds, chia seeds, bananas, almonds, okra, ladyfingers, oats, rolled oats. Coming to phosphorus, so it keeps, again, for phosphorus is also important for bone mineralization, keeps your bones and teeth healthy, strong. It maintains your energy levels. It is helping to form you your genetic material, RNA, DNA. It helps your cell membrane formation as well, phospholipids. Phospholipids. Your cell membrane, the cell wall is made up of phospholipids. Phosphorus and lipids, fats together, they form the cell wall. Okay, it gives this integrity and structure to your cell. It helps for healthy function of your brain and nervous system because it carries signals. Okay, just like calcium, it is also helping as a messenger to carry electric signals through the nervous system. It helps to maintain the normal acid base balance within your body, helps with the delivery of oxygen in the body. So these are the major functions. Energy level, it helps in maintaining energy level because of ATP, adenosine triphosphate, but ATP is broken down into ADP. When one phosphorus ion is released from ATP, that's when you get energy. Okay, so that's how phosphorus helps in maintaining energy. This phosphorus has to break down from ATP, adenosine triphosphate. It has to break down and become adenosine diphosphate. One phosphate ion has to leave. Then only energy can be produced. Absorption, there are two ways of absorption. One is between the cells and one is through the cells. Between the cells, you can see here passive. These are two cells of enterocyte, 1 and 2. There is a small space between these cells through the extracellular fluid. Okay, the space between two cells is measured by majorly it's the extracellular fluid. Even without entering the cells, entering the enterocyte, entering the intestine cells, it can just go in between of two cells and get into the blood circulation. That is one way. Between the cells, paracellular. Okay. Next is through the cells. It has to pass through the entirety of the enterocyte and then go inside the blood circulation. Okay, that is second way. So this is active. Through the cells, it is active. Between the cells, it is passive. Okay. Active means there is a specific channel through which phosphorus ion has to enter. And they use the sodium ions and phosphorus ions. They use the same channel. The channel through which sodium enters your intestine, the same channel is used by phosphorus as well to enter the intestine. And again, calbindin, if you remember calbindin from calcium, this is the same protein. It also helps in the transport of phosphorus from point A to point B. So that's about phosphorus absorption. If you use a lot of laxative and if you are suffering from diarrhea, steatorrhea, definitely phosphorus absorption also will fall down. So again, in both, along with calcium resorption, phosphorus resorption also takes place. Phosphorus goes into the blood. From the blood, it can go into various systems of your body. And from the various systems of the body, kidneys will reabsorb phosphorus, major phosphorus, send it back to the bones, or some amount of phosphorus, if it is too much, it is excreted from the body through urination. And again, parathyroid hormone also has a major role to play to increase the rate of phosphorus in the blood. Parathyroid hormone will increase the bone demineralization. Calcium is secreted into the bloodstream. Phosphorus is also secreted into the bloodstream. So RD of phosphorus, similar to calcium, 1000 mg per day. It's a macromineral. And in lactating and pregnant women, 1200 mg per day. Even in teenagers, 1000 mg per day. During infancy, only during infancy, the amount of phosphorus required is higher than calcium. Okay, the ratio is 1:1.5. So in infants, if the calcium intake is around 300 mg, phosphorus intake should be around 450 mg. So best sources of phosphorus, animal sources are the best source of phosphorus along with milk, fish, meat, poultry. Plant sources, sunflower seeds, all your nuts are good source of phosphorus. Whole grains, cashew nuts, gingerly seeds or sesame seeds, organ meat like liver, fish, specifically your pomfret, aluna fish, pomfret fish, rajma in for vegetarians, rajma, soybean, almond, black gram, okay, wheat flour. Then coming to magnesium. Magnesium deficiency is rare, it's not that common, but whenever magnesium deficiency is seen in humans specifically, it is because of some inborn errors of metabolism. The child is born with a specific malabsorption syndrome in which magnesium is not being able to be absorbed. Okay, so magnesium absorption deficiency is not an isolated condition. There is nobody who suffers from only magnesium deficiency. It comes along with various other deficiencies. When the child is born with some errors of metabolism and it's not able to, for example, lactose intolerance, okay, children who suffer from phenylketonuria, this galactosemia, they cannot have milk, okay, and milk is a good source of magnesium as well, right? So from childhood they may be suffering from magnesium deficiency just because they are not able to have milk, okay. So usually magnesium deficiency is associated with some or the other form of inborn errors of metabolism or absorption. If somebody is suffering from calcium malabsorption or calcium deficiency, more likely they will be suffering from magnesium deficiency as well. So around 20 to 25 mg of magnesium is present in human body, and 60 to 75% of that magnesium is found in bones, definitely. Other 25 to 30% is found in muscles or soft tissues. And just 1% of magnesium will be found in your extracellular fluid, the matrix around your cell. The functions of magnesium to maintain the electric signals between the neurons, for the transmission of the electric signals between the neurons for your nervous system. Milk, the hormones used in cattle, to induce lactation, they get these hormones and its derivatives will automatically get destroyed. Some of it is only left in the milk that comes from the cattle. And if you're using pasteurized milk, majority of these hormones is destroyed in the pasteurization. And after pasteurization, when it comes to your home, when you boil the milk again, putting it through another session of heat, again, majority of the hormones are destroyed. So basically speaking, the hormones used in cattle for inducing lactation will not have any effect on humans theoretically. Okay, so milk being adulterated with hormones is kind of a hypothesis, which so far we know there is no evidence to it. Okay, that hypothesis does not have a strong evidence to it because the hormones used in cattle, okay, cannot induce any change in human body. Okay, the hormones or its derivatives that is left, even the derivatives, if it is left, it gets destroyed during pasteurization. And when it reaches your home, when you heat the milk, when you boil the milk, okay, it gets destroyed. So packaged milk is good for health as long as it is fortified with vitamin D, vitamin B12. Okay. It depends on what state you are in, which part of the country you are in. Every state's by law, Government of India has said that the milk, packaged milk, should be fortified with vitamin D as well and vitamin B12 as well. There is a specific law that applies to uh, the milk units. Okay. So you can check your milk package for that, what kind of fortification is there. Okay, but usually it's kind of a myth that the hormones used in cattle is affecting the human health, because genetically it's not possible. Genetically, it's not possible for the hormones that is supposed to induce lactation in cattle can induce certain changes in the human tissues. Packaged milk, why it is better? Because it is fortified. Packaged milk comes with fortification. Packaged milk comes with fortification with other minerals and other nutrients. That is the reason why packaged milk is preferred. When you are using fresh milk, it becomes diluted. Okay, and the way how Indians use milk is again it's in a very diluted form. If you're using milk, either in tea or coffee, you don't use the full cream milk. You use the skim toned milk, or you add water to it. You